New England Baptist Hospital is the region's premier provider of orthopedic surgery and is nationally recognized for having some of the lowest infection rates in the country. When the COVID-19 pandemic began, we helped other hospitals make room to care for people with COVID-19 by treating their non-COVID patients. Since the pandemic began, New England Baptist has made significant changes to ensure that we can provide the safe and effective orthopedic care that patients expect from their orthopedic specialty hospital. All of our shared spaces, including waiting areas and the cafeteria, have been redesigned to allow for social distancing and to minimize high-touch situations. We have designated teams to regularly clean high-traffic and high-touch areas. We've developed very stringent criteria to determine who can safely have surgery at this time and recover well under our new process. We will get you home quickly and require you and your care partner to play a bigger role in your care and recovery. We will limit the number of visits you will make to the hospital and the amount of people that you will encounter. This includes providing virtual patient education and completing forms both electronically and verbally. Our pre-screening process will be customized to your individual needs based on conversations with your surgeon, your overall health, and information from your primary care physician. All surgical patients will be tested for COVID-19 prior to surgery, and you will be required to isolate yourself at home after taking the test until you come into the hospital for your surgery to ensure no new exposure during that time. You will be provided with instructions on what to do when you arrive at the hospital to minimize waiting time before your appointment. Moving between departments will be minimized. For everyone's safety, the hospital has very strict visitor guidelines in place. Upon entry to the hospital, everyone, including staff, patients, and patient escorts, will be asked symptom screening questions and have a forehead temperature reading taken. You will be asked the same symptom screening questions multiple times during your visit. You will be given a mask to wear during your visit until you are told to remove it by your care team. You will notice that everyone in the hospital will be wearing a mask, and clinical staff will be wearing eye protection. Patient escorts will only be allowed into the hospital under limited circumstances. We will keep your guest informed of your progress by telephone. If you are planning to stay at the hospital, please have your guest drop you off at the hospital on your day of surgery. If you are planning to go home that same day, we ask that your guests stay in their car or in areas designated for guests. Special accommodation will be made based on individual circumstance. If you are staying at the hospital following your surgery, please let your family and friends know that we have limited visitation. We are offering virtual visitations. Your care team will assist you in making those connections. We will send you home with detailed instructions on how to care for yourself after surgery, including caring for your surgical wound, how to manage your pain, and how to start rehabilitation. Before your surgery, prepare your home so after surgery, you can focus on recovering. The support of your care partner will be important, as most of your recovery will happen at home. We want to reassure you that we have taken extraordinary steps and will continue to do so as situations evolve to ensure the safety of our patients and our care team. We are grateful that you have chosen us for your care. We're looking forward to getting you back in motion.